We'll probably get started soon. Everyone, thanks so much for joining us today on this beautiful day in Boston for our Day of Action for 2022. So this year we're very excited to partner with the Massachusetts Public Health Association and their community partners to discuss the topic of what it means to be a public health voter, both nationally and then within the Massachusetts context. So a little bit of context on the Day of Action. And the Day of Action was founded by Dr. Amy Carroll Scott, who's part of our section in 2011. And the goal is to really partner with local organizations in the host city that we come to for APHA, with the goal of really elevating local solutions and issues and getting out of the convention center and supporting action on the ground. And our hope is also that the solutions that are shared here and the topics will inspire the attendees to take back what they can learn to their own communities. So we are excited to start with presenting more of a national perspective, and then we'll be going into talking about Massachusetts specifically and 2 ballot initiatives that are related to public health. I'll start first by introducing Gumanow. So Gnora is the Healthy Democracy, Healthy People Partnerships Director. She grew up in a family filled with organizers and started her professional career as a regional organizer for the Planned Parenthood Advocates of Oregon. She fought tirelessly to build grassroots movements for reproductive rights and democracy reform in Oregon, and before pursuing her graduate degree at George Washington University. And most recently, Gnora worked at the Alliance for Youth Action as the director for Network Capacity, where she continued to support youth centering democracy reform and economic justice across the country. So Gnora brings a deep understanding of what voting rights means and what it takes to build strong community organizing campaigns. And she's also currently pursuing a doctorate in public health. So please join me in welcoming Gnora to speak about public health and voting.
Hi, thanks so much. My name's Gnora, and I'm the Partnerships Director at Healthy Democracy, Healthy People. As we all know, tomorrow is Election Day. Millions of people have already voted, and millions more will vote tomorrow. We will elect a government at the national level in Senate and congressional races, and we will elect lawmakers to represent us in state, county, city, and municipal elections across the country. Many people, including those in Massachusetts, will also vote on ballot measures and local referendums. However, not everyone will be able to cast a ballot this election. Black voters, Indigenous voters, and other voters of color, along with voters with disabilities and eligible voters whose native languages are not English, will face heightened barriers due to discriminatory policies that have been enacted over the last decade and honestly the history of our country. There is no question that inclusive democracy is a vital condition for health and equity. Since the founding of our country, those who have had power in the electorate have shaped policy at every level. From slavery and Jim Crow laws to Reconstruction, the Civil Rights Movement, and beyond. The power to vote and the ability to organize collective power has been a determining factor for health and racial equity. Throughout our history, when we have committed to expanding voter participation and representation, we have seen improvements in health and equity. For example, the 20th century civil rights movement spurred an expansion of voting rights and ushered in more inclusive policies in education, housing, economic opportunity, and healthcare, including the establishment of Medicare and Medicaid. In 2020, the nation experienced the highest voter participation that we have seen in our entire history, with turnout increasing across the political spectrum and across all demographic groups. This was aided by expanded opportunities and promotion of mail and early voting and robust voter outreach programs. However, since the 2020 election, state legislatures across the country have introduced hundreds of bills and passed dozens of laws that make it harder for people to register and to vote. These laws, alongside the voter suppression measures enacted over the last decade, make it especially difficult for voters of color, voters with disabilities, limited English proficiency voters, and other marginalized communities to make their voices heard in our democracy. The movement for a fair democracy is happening across the country. While Congress, the executive branch, and the Supreme Court can do things to expand access, the battleground for democracy is at the state and local level. County elections officials determine how they process, count, and where they collect ballots. State legislatures and election officials determine the schedules for early voting and the rules for voter registration and ballot collection. How many poll workers are hired? Who qualifies for absentee ballots? And what kind of identification is used to verify eligibility are all decisions made at the state and local level. Make no mistake, regardless of what ballot measures or policies are included in your ballot, health is on the ballot, democracy is on the ballot, and equity is on the ballot. But what can public health do? First, we must collectively recognize as a field the role power plays in contributing to health equity. Then we need to build our collective power by organizing a public health narrative and story and organizing our people. Finally, we have to join as active allies in the movement for a more inclusive democracy and offer our public health tools and resources to the greater movement. Public health practitioners are trusted messengers. We can use reports, white papers, and public testimony to make the case for inclusive democratic practices. But none of this happens without partnerships. We need to build cross-sectoral relationships that are authentic and based in trust. Public health does not need to be the leader. We need to be an ally. We need to listen. And when asked, we need to show up, work hard, and act. It starts small. Join a neighborhood group. Learn about your county elections offices or campaigns in your precincts. Talk to colleagues, family, and friends, because none of us can do this alone. We must be intentional, we must be vigilant, and we must act. Thank you so much.
Thank you, Nora. I'm Jeneczka with the Massachusetts Public Health Association, and we couldn't have gotten a more beautiful day to turn out for public health and voting. As you all know, the health of communities is impacted by the politics and policies that shape the world around us, from the built environment to clean air and safe drinking water to stable housing and everything in between. State and local governments make decisions about transportation, taxes, and other investments in public goods and social services. So a government's decision to fund and cut or reform or backslide has the power to improve or undermine the health of a community. So public policy can change and improve population health. But as we heard, the right to vote is fundamental because it's protective of all other rights. A healthy democracy is essential to create a healthier, more just world. But as we heard from Nora, the health of our residents is being threatened by attempts to restrict voting.
Whether at the local, state, or federal level, residents shape the social determinants of health by casting their ballot. And in Massachusetts, we have the opportunity to weigh in on 2 critical ballot initiatives with far-reaching implications for health equity and racial justice. So question 1 for the Fair Share Amendment and question 4 for safer roads. A yes on question 1 will make the Commonwealth taxation system fair while directing resources to 2 key drivers of health outcomes: access to public transportation and educational opportunities. Ooh, windy. A yes on question 4 will uphold a common sense law known as the Work and Family Mobility Act, which creates safer roads by ensuring that all qualified Massachusetts drivers, regardless of immigration status, can obtain a standard driver's license, while ensuring that all Massachusetts families can make essential trips like go to the doctor, drop their kids off at school, and pick up groceries. So voting yes on 1 and on question 4 is a critical opportunity to effect transformational change in the Commonwealth and make our communities healthier. And we're so grateful to healthy communities. We're grateful to be joined by our campaign partners, Brittany and Chrystel. They'll talk a little bit more about yes on 1 and yes on 4. To get us started, here we have Brittany Gudanowski. She is with the Boston Children's Hospital and is a fellow with the Fair Share campaign. And Brittany has been fighting for the Fair Share Amendment to create a fairer system and a brighter future for our Commonwealth. So please welcome Brittany.
Hi everyone, thank you for that quick introduction. And so I do have a career in public health in healthcare as my day job. So people often ask me why I'm so politically involved on top of that. And the honest answer is that it really does matter. The policy choices that we make and the people who we choose to elect crafts policy that affects every part of our lives, every aspect of our lives. And it's also reflective of the values that we share and how we choose to prioritize things. And so I'm here to share a little bit about question 1 and why that's so important in Massachusetts, and how we also hope to set an example for other states across the nation to implement similar policies. And so question 1 is often referred to as the Fair Share Amendment, or yes on number 1 in our ballot this election season. In Massachusetts, voting yes on question 1 would create a new 4% tax on personal income over $1 million. It will be a constitutional amendment, so it will change the state constitution, and it is binding on the state legislature. And so it is expected to generate about $2 billion per year. And to give just a little example, if you were to make $1,001 in a year, it would be an extra 4 cents on that dollar over the $1 million. And then that money would be constitutionally dedicated specifically to the areas of public education, transportation, and roads. So that means that our legislator cannot just use the revenue however they want. It has to go to those areas. And this is to things like public schools, hiring teachers, counselors, working on bridges, working on the MPHA, fixing potholes, making sure our schools have supplies and air conditioning, all kinds of essential things that have really chronically been underinvested in and underfunded. And a really key point here is that over 99% of residents in Massachusetts will not pay a penny more under this new constitutional amendment. So why do we need it? For the first point, it will make our tax system more fair. So actually right now in Massachusetts, when you look at just state and local taxes, the highest group of earners in our state are actually contributing a lower share of their income to state and local taxes right now in Massachusetts. So this is one way to make our tax system more fair. And we've even seen the past couple of years during the pandemic how the rich have only gotten richer. Well, our communities, people of color, and small businesses have been devastated during the pandemic. We see that this group of people are making higher profits than they ever have before. And so we're looking to kind of address these ongoing issues that we've had and really make our economy more fair and work for everybody in our state. Another point is that this allows us to invest in our communities in these areas that have been historically been underinvested in. As I said, it goes to public schools, roads, bridges, things that all need more money and things where issues have only been further exacerbated under the pandemic. So we can really use this to address these needed areas. And finally, to make our state and economy stronger for all of us. We all benefit when we have more reliable infrastructure and an educated workforce. And we all do better when we have an economy that works for all of us. And finally, I want to talk a little bit about what our opposition looks like. Our opposition is largely funded by a small group of millionaires and billionaires. They've actually gained over $5 million from just 5 really rich families who are helping to fund their campaign and vote no on one. And I can go through just a couple of the common opposition and some of the misinformation that they've been trying to spread. One of the main points is people will bring up how we have a budget surplus right now and there is money going back to taxpayers. But this is just kind of a one-time thing that's happened this year that has not happened in decades. And it does not, one budget, one economic cycle does not address these issues that we've been having chronically for years and years that have been underinvested. And more importantly, it does not require low and middle income families to pay more. Another problem that often comes up is related to the sale of homes. People are worried that this will target home sellers if they might sell a home for more than $1 million in 1 year, or people who use that as a nest egg. And the truth is that last year, less than 2% of homes in Massachusetts sold for a gain of more than $1 million. So it specifically addresses the gain on the value of the home from when it was purchased to when it was sold. And if it's your primary residence, you can deduct up to $500,000 for the sale of your primary residence, as well as any money that's gone toward renovations and things over the years. So this really will not affect any regular homeowner in our state. Another issue that comes up is people claim that it will affect small business owners. And the truth is that less than 3% of small businesses in our state had enough in personal income to actually make over $1 million in a year. The large majority of businesses, if you're making millions of dollars, you're probably not a very small business. And also, if you're contributing to things like education and infrastructure, that's better for everybody. It's better for your workers to be educated and to have a reliable way to get to work every day. And finally, people often argue that millionaires will leave the state. Research has been done that shows this really is not true. It will not happen. Millionaires are also invested in their local communities. They've grown their business here. They're invested in the state, and they're not going to leave over something like this. They can often afford to choose where they want to live. And again, I just want to end on this money will really benefit all of us. We have a better state when we invest in everybody, when we make it a fairer economy and make these much needed investments in education and transportation. Thank you.
Thanks so much, Brittany and Jeneczka, for providing an overview of Yes on 1. So next I'd like to introduce Chrystel to discuss Yes on 4 for safer roads.
Hey y'all, thank you so much for giving some of your time. I know some of y'all may be traveling from far, some of you may just be jumping on the T and are a little bit closer, but however you got here, whatever brought you here, just thank you so much for giving up your time to listen about these important ballot questions. Question number 1 and question number 4. My name is Chrystel and I have a background in public health and I am now working at a labor union, SEIU 32BJ. And yeah, let's give it up for labor. Unions for all, y'all. But we represent a large group of workers that are largely doing service work. So these are folks that do the cleaning in hospitals, in higher education, on the MBTA actually, on the train, right? And these are also people that are making sure that our clinics are clean and that people can be seen, essential workers that a big narrative was uplifted for during the pandemic and that now we're just trying to continue uplifting. I got into this work because, like many of you, I understand that health does not just happen when you go see a doctor or a PA or a nurse, right? Health happens at your home, health happens on the train, health happens at your school. And my quality of life improved significantly when my dad got a job that was unionized and allowed me to have set primary care so that I can have a PCP that I had history with, that knew about me and could take good care of me. right? And that brings me here today. My dad was a cleaner as well. So the folks that I work for now are people that are like my family. And question number 4, as Jeneczka mentioned, would improve the quality of life of folks across the Commonwealth of Massachusetts by doing a simple thing which would allow them to have the mobility to get across the state. If you're from Massachusetts, you know that if you live in the greater Boston area, you have access to public transportation. Sometimes it's on fire, and that's unfortunate. That's why we're trying to get question 1 passed, so that it could be a little bit better. But if you live further out in the state, you don't have very many options. We talked to folks that would walk for hours, that worked to provide us food, the food that we eat, the food that we buy during the pandemic, and walked for up to 4 hours to get to the fields. Then that was just to get to point A, and then they had to walk more hours to get to point B to be able to pick the crops that we are able to benefit from. And y'all, this is a fight that has taken more than 20 years here in the state of Massachusetts. And I have the honor of being a co-chair for the Driving Families Forward Coalition that has been behind this effort for the past 4 years. But it has been because of the work that has been done for the past 20 by impacted individuals, by community leaders, by this broad coalition that came together that includes public health professionals. I want to give a shout out to MPHA. Y'all have been there time and time again, providing testimony when we had public hearings. You've also been there when we did press events, and we wanted to make sure that folks understood the broad importance of this issue, right? And how health matters when it comes to this ballot question. Ballot question now. It was a legislative battle, y'all, that again took 20 years, and we won it. We won it in June, and we were so excited, y'all. We did that. Yeah, round of applause. Massachusetts officially became the 17th state to pass this legislation. 16 other states have done this for almost 30 years now. The sky hasn't fallen, and we have seen the amount of hit and run crashes decrease in multiple states, improving health for folks, right? Because we know that when people are tested, licensed, and insured, it means safer roads for everyone. And it also means safety for folks that are maybe undocumented and fear that they may not be able to make it back home to their families simply because they're going to drive their car to get to work, to take their kids to school, to drop them off at cheer practice, to take them to see the doctor, to pick up a prescription, right? So many needs that people have. This is a basic necessity. It is not and should not be a privilege. It should be a right. I mentioned we won this in June. Just 6 days later, an opposition group formed, largely backed by the Republican Party. Why? Because they do not want to see our people thrive. They don't want to see immigrants doing well in the state and across the country, right? So they formed an opposition, collected enough signatures to get on this ballot November 8th, and they're trying to take this away from us. And we fought so dang hard to get here, y'all. We will not let it go by all means necessary. We are doing everything possible. We've had 2 months, which my friends at Question 1 know that they've been at this for a year and a half, have been able to raise millions and millions of dollars. We have had 2 months. That's almost impossible to talk to the 1.2 million votes that we need to win this, which is why it is so imperative that we have folks like you here learning about this and helping us spread the word. Whether you live here or you're visiting, I invite you to join a phone bank. Today we're phone banking from 2 to 7 p.m. Tomorrow the same. We will be phone banking all dang day. We will be hitting the doors. So if you're able to give an hour, 2 hours, 30 minutes, whatever it is, jump on a phone bank with us. If you haven't done it before, don't worry. We'll have people on there that will train you and give you all the tools necessary. You'll have a script. You'll have question and answer. But again, just want to thank y'all for giving space to this, for being supportive of this. And again, we know that health matters and health is at the pulse. So I'm going to invite you to chant with me. You want to come up here? Come up here. So we're going to do yes on 1, yes on 4, yes on 1, yes on 4, yes on 1, yes on 4. And I'm going to put it a pause there. Why? Because we know that when we fight, we win. So I'm going to invite you to do that with me too. When we fight, we win. When we fight, we win. When we fight, we win. Thank y'all so much. I hope you enjoy the rest of the conference.
All right, let's give another round of applause to Chrystel and Brittany for their time. Now, we're gonna switch gears a little bit and we're gonna provide some time to take action. But before we do that, let's get up close and personal. Everyone get close. We're gonna take a selfie so we can show all that turned out for the day, and then and then we're gonna get into the day of action. All right, everyone get close. All right.
Bad angle for me. Wait, Omi, why don't you get in it? We can ask if you were going to take it. No? Okay, back to the action.
All right, thank you all. So, my volunteers, if you have an orange slip of paper and a white QR code, please raise your hand. We created a social media toolkit for everyone to take action today. There are 4 ways to take action. You can join the tweet storm, you can sign up for a phone bank, you can amplify Yes on 1 and Yes on 4 social media, and you can text your friends and remind them to make a voting plan, educate them on Yes on 1 and Yes on 4. So everyone take out your phones, turn your camera on, and then get to one of our folks that have the cute little QR code papers and then get to tweeting and texting. How's it going? If you send a text to your friend, raise your hand. Woo! Awesome! If you post it on social media, raise your hand. Heck yeah! All right. Bonus points if you take a selfie and also tag a couple friends on social media. Encourage them to take action on Yes on 1 and Yes on 4. Thank you to everyone who's taking action. Just a reminder that we're going to be taking action all day. So when you go back to the conference, please encourage people to take action in support of Yes on 1 and Yes on 4 and to be a public health voter in their state and in Massachusetts. Tag folks that you know here and get them to turn out the vote. Share the link, sign up for a phone bank or canvas for Yes on 4. And if you have any questions, we'll be hanging back and feel free to approach us. So with that, I'm gonna do another last round of applause for our presenters, Gnora, Chrystel, and Brittany. And I'm gonna turn it over to Raga for our closing remarks.
Thanks so much, Jeneczka, and thanks so much to all our great speakers for sharing about what motivates you on this campaign and the tie between these important issues and promoting public health. And we hope that this was informative for everyone, regardless of whether you're based in Massachusetts or elsewhere, to think about ways that we can support initiatives happening here in our host city, and then also what you can take to be a public health voter in your community as well. So I just wanted to take a moment to say thank you to all of you for all your actions and for joining. I also wanted to thank the CHPPD section of APHA for supporting this work, and several other sections, including the ethics section, the Asian and Pacific Islander Caucus, and the public health education and health promotion sections for co-sponsoring and getting the word out. Also want to thank Whole Foods for giving us the delicious lunch today, and then to all of you for attending. So I hope that you enjoyed this event and continue to take action, and feel free to reach out if you have any questions. So thank you so much.